Let us pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and parliaments for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor us, your servants, whom you will be pleased to call to the performance of important trusts in this republic. Let your blessings descend upon here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and a faithful manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our country and of those whose interests you've committed to our charge. Amen. Next order.
Order number 1, administration of oath.
Next order.
Order number 2, communication from the chair.
Next order.
Order number 3, messages.
There is a message. Honorable members, I have received a message from the county secretary, who is also the head of public service in the county. And it's about notification of appointments and reassignments in the county executive. Pursuant to Article 179 2B and Article 235 of the Constitution of Kenya, 2010, and in accordance with the Section 35 and 45 of the County Governments Act 2012, Her Excellency, the Governor has made the following changes in the executive. Part A, following the successful vetting, Her Excellency, the Governor appointed the following. 1, Mr. Abros Ogeto as the County Executive Committee member, Public Service, Devolution, Citizen Engagement, Disaster Management, and Humanitarian Assistance. 2, Elgar Adoyo as the CECM, that is the County Executive Committee member for Youth, Sports, Inclusivity, Gender, and Social Services. For the County Chief Officers, Victor Achoka was appointed to the Directorate of Resource Mobilization. 2, Joseph Kibusia was appointed to the Directorate of the Department of ICT, E-Government and Public Communications. 3, Francis Joroge was appointed as the CEO for the Youth, Talent, and Sports. Part B, it's about the reassignment of county chief officers. Margaret Kenyanjui has been moved to reassigned duties at the Department of Agriculture as a CEO. 2, Degwa Samuel Joroge has been reassigned duties at the Department of Finance. Baraza Kennedy has been moved to the Department of Infrastructure. Joseph Kibusia has been reassigned duties to the Directorate or Department of Public Service and Devolution. Joyce Sese, the Department of Disaster Management and Humanitarian Assistance as the County Chief Officer. Stella Mwaura has been reassigned duties as the CEO, Water, Environment, Climate Change, Natural Resources and Energy. Then Charles Koech has been reassigned duties as the CEO, ICT, E-Government and Public Communications. Kennedy Mugo has been reassigned duties as the CEO for Lands and Physical Planning. And John Murima as the CEO, Health Services. And Newton Moura as the Chief Officer, Office of the County Secretary, / Deputy County Secretary. Thank you. Next order.
Order number 4, petitions.
Next order.
Order number 5, papers.
Next order.
Order number 6, notices of motion.
Next order.
Order number 7, statements.
Next order.
Order number 8, motion.
There is a motion by the Honorable Simon Kamau, Chairperson, Committee on Park.
Thank you, Mr. Speaker, sir. I would wish to move a motion on the report of the Committee on Public Accounts and Investment Committee on the Auditor-General's report on the examination of the financial statements of Molo Sub-County Level 4 Hospital for the year that ended 30th June 2023. Mr. Speaker, on behalf of the members of the County Assembly Public Accounts and Investment Committee, I beg to move the adoption of the report of the committee on the report of the Auditor-General on the financial statement of the Level 4 hospitals in Nakuru, and this one specific that ended 30th June 2023, and this one specifically is for Molo Level 4 Hospital. Mr. Speaker, the Committee on Public Accounts and Investment has the following mandates. 1, the committee is mandated to examine the accounts showing the appropriation of the sum voted by the Honorable House to meet the public expenditure and of such other accounts laid before the House as the committee may think fit. Number 2, Mr. Speaker, is that the committee is supposed to examine the reports and accounts of the public investments. Number 3, the committee is also supposed to examine the reports, if any, of the Auditor-General. Number 4, it's also supposed to examine in the context of the autonomy and efficiency of the public investment, whether the affairs of the public investments are being managed in accordance with the sound financial or business principles and prudent commercial practices. Mr. Speaker, the composition of the committee, of course, is included in the tablet, and of course, it's comprised of the following members. Chairperson, I here, Simon Kamau. Of course, the list is there attached, Mr. Speaker. Mr. Speaker, as we discharge our mandate, this committee sometimes is faced by various challenges, and one among them is that members noted, of course, the time and resources that are allocated to the committee is too little in comparison to the work that they are supposed to do. And Mr. Speaker, I want to emphasize on this, and I would beg the honorable members of this House, and those specifically in liaison, when we are doing a budget, please we consider this committee, because, Mr. Speaker, as we speak, we have over 70 reports that we are supposed to work on, and this one means we have to create extra time. Besides the normal sitting of the Assembly, then this committee, of course, has to schedule more days, because, of course, this committee we cannot interrogate all these entities within the stipulated 40 minutes that the committee is supposed to sit. Therefore, Mr. Speaker, these members, others are coming from from Nairobi, others are coming from Keringet, and of course, Mr. Speaker, these members, in one way or the other, they need to be facilitated so that they can work. And of course, when they are coming extra days. For example, they come on Monday, they come on Thursday, and they come on Friday, Mr. Speaker. And of course, in this, that is why we are making a humble appeal to the Office of Speaker and of course those in liaison to consider this, because not unless this happens, then at some point we might not be able to do all this that we are supposed to do. Number two, Mr. Speaker, there is also another challenge. When we do these reports, when we interrogate all these entities, there are some recommendations that we make as a committee. It is my humble appeal, and I said this before, that the Committee on Implementation needs to pick up on these recommendations and act on it. Because when we are doing this, Mr. Speaker, we are doing this so that we can close the gaps where, of course, inefficiencies are experienced in some of these entities that we interrogate. And not unless those recommendations are acted upon, then it means we shall be moving a report after report, and of course, nothing is going to happen. So I'm making a humble appeal to my colleague, Honorable John Mwangi from Turi, who is the chair implementation, to be acting on these recommendations so that where we are supposed to close those gaps, we can do it, and of course in good time, Mr. Speaker. The committee proceedings, Mr. Speaker, the committee held sittings in which it closely examined and had evidence from the management of Molo Sub-County Level 4 Hospital in its inquiry into the audit report of Molo Sub-County Level 4 Hospital for the year that ended 30th June 2022. The committee had and received both oral and written evidence from the management. The records for the same adduced documents and notes received by the committee form the basis of this committee's observations and recommendations as outlined in the report. And of course, this can be obtained in the Hansard reports of the committee available in the County Assembly of Nakuru. Mr. Speaker, of course, there are other level 4 hospitals within Nakuru County of which we have either interrogated or we are in the process of interrogating. And the list is there from number 1. I think it is there in the members' tablets, from number 1 to number 16. Mr. Speaker, this committee acknowledges, and it extends acknowledgement of this committee, it extends its heartfelt appreciation to all its members for their dedication, hard work, and unwavering commitment to ensuring transparency, accountability, and good governance within Molo Sub-County Hospital. Each member's contributions, insightful analysis, and collaborative efforts were essential in thoroughly reviewing the Auditor-General's finding and formulating comprehensive recommendations. Mr. Speaker, this report, as per the Auditor-General, was placed as a qualified opinion. And it was placed as a qualified opinion because of the following reasons. One, of which we are going to give the details for the same. One, the reason as to why it was referred to as a qualified opinion is that there was non-disclosure of inventory balance. That was one. Number two, there was non-disclosure of property, plants, and equipment. Number three, as to why it was a qualified opinion, is that there was failure to transfer revenue to the County Revenue Fund account. Number four, Mr. Speaker, is that there was also delayed completion of the hospital block. Number five, Mr. Speaker, is that there was irregular engagement of the casual workers. Number six, there was unfulfilled orders. Number seven, there was expiry of medical supplies. And number eight, last but not least, Mr. Speaker, there was the issue of stockouts. We are going to discuss this in details. And we start with the first one, Mr. Speaker, and this one was non-disclosure of property, plant, and equipment. Mr. Speaker, in the financial statement of Molo Level 4 Hospital, they were lacking the following. They were not attached the price for the following property, plant, and equipment. One, there was the issue of the land. Number two, there was buildings, there was motor vehicles, there was furniture, computers, and equipment. Of course, these ones were not disclosed in the financial statement. Mr. Speaker, in as far as this one is concerned, and we said this, and I want to repeat again as the chair, this one is a very serious issue that needs to be addressed, either at the facility level or at the departmental level, that is the health department. Because we cannot keep on saying that we are investing both the department and maybe allocation from Mheshimiwa in Molo. We are allocating money, but of course we are allocating money to some of these, maybe a land that we don't have the ownership documents. It is very risky, Mr. Speaker, because at some point, some people may come again and claim that the land on which maybe this hospital lies is theirs. And of course, this one can, of course, be a big blow to the county government of Nakuru, specifically to the people in Molo and those who are surrounding and using that particular facility. So, Mr. Speaker, the committee had the following findings on the same. We said the hospital financial statement reported as zero balance for property, plants, and equipment, despite the physical assets being present. Assets such as land, building, motor vehicle, furniture, computers, and equipment were found. But of course, ownership document was not provided during the time for audit. This, Mr. Speaker, and I think this has been an issue year in, year out. And maybe I want to call upon the honorable members. If at all there is a person who is sleeping on his or her job, then we need to act on this person. Because the issue of title deed is primarily within the county government of Nakuru, specifically in the Department of Lands, and of course they have to work in collaboration with the Department of Health, Mr. Speaker. If these people cannot address such serious matters, then this becomes an audit issue year in, year out. Mr. Speaker, then I think somebody is sleeping on his or her job, and we need to act as a house. If they are not ready to work, then, Mr. Speaker, we can even eliminate them, and we have that mandate as the Assembly. And then so many people are interested outside there to work on their behalf if they cannot be able to address such weighty and serious issues, Mr. Speaker. Number two, the hospital's failure to disclose assets in the financial statement raises concerns regarding transparency and accountability. And on the same, the committee made the following recommendations. The hospital should conduct a thorough asset verification and provide full documentation, including the title deeds for the land and ownership document for the other assets. Number two, Mr. Speaker, the financial statement going forward should accurately reflect all the property, plant, and equipment belonging to the hospital. Mr. Speaker, the second issue, as raised by the Auditor-General, was the unconfirmed inventory balances. And Mr. Speaker, the statement of financial position reflects inventories balance of Kenya shillings slightly over 7.2 million. However, the stocktakes report as at 30th June 2022 was not provided for review. And Mr. Speaker, it is good for the honorable members to note, before a certificate is issued by the Office of the Auditor-General, they have got the entry meeting and the exit meeting before they do a certificate. And all these statements are requested by the Office of the Auditor-General. But these people, maybe a period of even 3 months, being requested to provide the same documents, and they cannot provide them, then, Mr. Speaker, there is an issue, and maybe the management of this particular facility needs to look into it. Then it means either those documents are not there, or maybe they have made them not available by design. Because you cannot be told to provide a document for over 3 months and you cannot be able to provide it, Mr. Speaker. So in the circumstances, the accuracy, completeness, and valuation of the inventory balance of 7.2 million could not be confirmed. Mr. Speaker, on this, the committee had the following findings. One, that the hospital failed to present stock take reports for its inventory balance of Kenya shillings of slightly over 7.2, thereby casting doubt on the accuracy, completeness, and evaluation of the inventory. Number two, Mr. Speaker, although the management claims an annual stock take was conducted, the absence of the supporting document and the certified report for audit raises concern over inventory management. This is what I'm saying. If the Auditor-General has raised a certificate, then it means he or she has requested for this document for quite some time, and they were not there to be provided. That is why the certificate was issued on the same. Mr. Speaker, the reason as to why maybe some of these people are not providing the documents when required by the Office of the Auditor-General is sometimes they want to manipulate some of these documents so that now the documents can be in their favor, Mr. Speaker. The recommendations that were made by the committee on the same is that the hospital should ensure that certified stock take reports are provided and maintained in accordance with the established procedures. Number two, reports should be supported with appropriate documentation to ensure transparency in inventory management. And of course, Mr. Speaker, I can add this, when they are providing the appropriate document, then it should be done in good time, Mr. Speaker. Mr. Speaker, another issue was the failure to transfer the revenue to the County Revenue Fund account. Mr. Speaker, the statement of financial performance reflects rendering medical services income amount of over 70 million. However, the amount was not transferred to the County Revenue Fund account for approval by the Control of Budget before withdrawal. This, of course, is contrary to Regulations 81(1)(3) of the Public Finance Management. That is the County Government's regulation of 2015, which states that a receiver of revenue shall promptly deposit into the county exchequer account all receipts due to the County Revenue Fund. Mr. Speaker, on this one, the committee had the following observations or finding. One is that the hospital failed to transfer revenue to the County Revenue Fund account as required by the Public Finance Management Regulations of 2015. Number two, Mr. Speaker, is that the hospital management was in breach of the PFM Act, Public Finance Management Regulations of 2015 regarding the handling of public funds. On this, the committee made the following recommendations. One, the hospital should immediately comply with the Public Finance Management Regulations and transfer all revenue to the County Revenue Fund account for the approval by the Controller of Budget. Number two, Mr. Speaker, that management should establish a clear process to ensure adherence to these regulations in the future. And it is good to let you know, Mr. Speaker, that we agreed as the committee. At some point, we will be popping in some of these facilities to see whether, of course, they are doing what we recommended as the committee. Number three, Mr. Speaker, another issue as to why this report was referred to as qualified was the delayed completion of hospital block. Mr. Speaker, this is also a serious issue. And maybe I want to appeal, maybe to this House, maybe through the Department of Health. If we are appropriating money, then can we appropriate money maybe from the beginning, maybe to the completion of a particular facility? Because if we do it, and of course we leave it halfway, then it means there is no value for money. Because that particular facility, of course, it came up as a result of maybe public participation. Then it means the people around that particular area, be it be in Molo, be it be in Keringet, be it be in Njoro, those people, after public participation, then it means they required that particular facility because, of course, the way we work through public participation. But of course, if these people need this particular, maybe this particular facility for the service that is rendered there within, and of course, it takes some time, because as you can see, this particular building was allocated 150 million, and of course, it was given 40 weeks for it to be in completion. But Mr. Speaker, the last time we checked, that was maybe when we were doing this report, this work was not complete. Then it means there is no value for money, and the services that are supposed to be rendered in that particular facility, of course, were not rendered. Then it means we could even better place this particular money to somewhere else if they cannot be able to complete this facility, and the people in Molo and surrounding areas to enjoy the services that were supposed to be provided in this particular facility. Mr. Speaker, on this one, the committee had the following findings. One, the outpatient and inpatient block construction was delayed, with only 60% of the work completed by April 2024, despite initial timelines and extensions. The incomplete project raises concern over the effective use of public resources and value for money in the construction process. And that is why, Mr. Speaker, sir, maybe we would want to appeal even those people in the procurement who are, of course, awarding these jobs. Of course, one of the considerations that they should make, if they are not making it, then they should consider those contractors, of course, who have capacity, so that at least now we don't have stalled projects, simply because a contractor was given, but this particular contractor lacks capacity for the same. Mr. Speaker, the committee on the same, in as far as this block is concerned, incomplete block is concerned, then the committee made the following recommendations. One, the hospital should work with the relevant county authorities to ensure the completion of the outpatient and the inpatient block on time. Number two, Mr. Speaker, is that the accounting officer, the Department of Medical Services, Public Health and Sanitation to fast-track completion of the stalls project and a report of the same to be availed to the committee within a period of 90 days upon adoption of this report. And of course, Mr. Speaker, I as the chair and my committee, we are going to ensure that, of course, we give a report back to this particular assembly if this has taken place. And that is why, of course, I want to congratulate Dr. Murema. Now other responsibilities has been added onto him. Then it means he has to bear more responsibilities. And I wonder, I don't want to say that Dr. Murema is not competent, but of course he has to pull up his socks so that at least we can be able to see the completion of these particular facilities. And not only in Molo, because of course we are bringing other reports. Of course, we have other reports, Mr. Speaker, of the same, or of the same similar issue. Mr. Speaker, number two, another recommendation that was made by the committee is that, number three, strict adherence to the timelines. The county health department should establish firm deadlines and ensure strict compliance. Any further delays should result in contract termination and possible legal action. Because, as you can see, Mr. Speaker, the contractor for this particular job, of course, they kept on maybe setting new deadlines. So I don't know the reason as to why they should keep on setting new deadlines. That is why, according to the way we interrogated these people, then it means some of these contractors lack capacity. And of course, such contractors, and of course, I'm not against the contractors, but of course, we have contractors who have the capacity. Given work and time frame, then they can be able to complete the projects and in good time, Mr. Speaker. Mr. Speaker, another recommendation was that there was supposed to be regular updates should be made public to ensure transparency and accountability to the taxpayers. A project implementation committee should be formed to oversee the completion of the hospital block. Mr. Speaker, another issue that was raised by the Auditor-General was the irregular engagement of cash workers. I think this is cutting across almost all the facilities, whereby we are irregularly engaging the cash workers. Because we know the cash workers, as per the law, they are supposed to work maybe only when the need arises. But of course, according to this particular report, we have some of the cash workers in Molo Level 4 Hospital, Mr. Speaker, who are working even over 3 months. And Mr. Speaker, if a cash worker works over 3 months, maybe without renewing the contract, then it means this person can even take you to, or legal actions can be taken against this particular facility. And of course, if legal action is taken by these cash workers, then it means then we are adding more money for litigation, Mr. Speaker. Therefore, this is an issue that needs to be looked at, and of course, they should strictly adhere to the laws that have been set by the County Public Service Board. Mr. Speaker, on this one, the committee had the following findings. One finding for that matter: the hospital engaged cash workers for more than 3 months, contrary to the regulations set by the County Public Service Commission and the Employment Act of 2007. This breach highlights a lack of adherence to the public service employment regulations. Mr. Speaker, on this, the committee made the following recommendations. One, the hospital should adhere strictly to the regulations on cashier employment and ensure that cashier workers are only engaged for short-term tasks as stipulated in the Employment Act and County Public Service Guidelines. Number two, Mr. Speaker, is that the management should liaise with the County Public Service Board regarding staffing shortages and request the recruitment of additional employees for long-term contract or on permanent basis. Mr. Speaker, another issue as raised by the Office of the Auditor-General was non-compliance with the Kenya Quality Model for Health Policy Guidelines. And on this, Mr. Speaker, and I believe the honourable members can be able to see this, this one is of course touching on the infrastructure as well as the human resource. In as far as the human resource, there are those set guidelines that for it to be referred as a level 4 hospital, there are those guidelines and the officers that are supposed to be within that particular facility. And again, there are infrastructures that the guidelines in as far as infrastructure is concerned that has been set. But of course, this one, the Molo Level 4 hospital, of course, is falling short of this. In as far as the human resources is concerned, then a level 4 hospital like Molo is supposed to have 16 medical officers, but of course, when the time for, during the time for audit, we only had 5 medical officers, then it means we lacked 11 of them. Then, and other, of course, medical, other personnel are indicated there, and of course, we can conclude that, of course, because these officers, Mr. Speaker, they are supposed to provide services to this particular facility. If, for example, a facility is lacking over 11 medical officers, then it means automatically the work that is supposed to be done by these officers is going to be compromised, because there is no way that work for 16 medical officers can be done by only 5 officers. Mr. Speaker, it means services there are going to be compromised, Mr. Speaker. Look at this, Mr. Speaker. This is even serious. The Kenya Registered Community Health Nurses, they are supposed to be 75, but the ones that are in Molo during the time for audit were only 16, meaning there is a variance of 59 registered community health nurses. Then it means automatically we don't require rocket science, Mr. Speaker, to know that the services in that particular facility are compromised because of lack of these particular personnel, Mr. Speaker. In as far as the infrastructure is concerned, and I believe the honourable members have got that particular list, of course, again, we have deficiency in these particular infrastructures. And therefore, automatically, the services there, Mr. Speaker, are going to be affected. On this, the committee had the following findings. One, non-compliance with the health policy, and the hospital does not meet the requirement, staffing, and equipment standards as per the Kenya Quality Model for Health Policy Guidelines. The deficiency contravenes the first schedule of the Health Act of 2017 and Article 43(1) of the Constitution, which guarantees the right to health care. Number two, Mr. Speaker, is that the hospital is operating at only 24% of the required staffing capacity, with a shortfall of think there was a typing error here, with a shortfall of maybe 59 or 75 staff members, all included, including critical medical personnel such as anesthesiologists, general surgeons, and pediatricians. This deficit compromises the quality and the efficiency of healthcare services. Mr. Speaker, the hospital lacks key medical equipment and infrastructure, including ICU and HDU beds, a fully functional renal unit, and operational theaters. These deficiencies hinder the hospital's ability to provide specialized medical care. Number 4, Mr. Speaker, the failure to meet the prescribed health standards exposes the county government to legal risks and potential litigation. Additionally, the situation raises ethical concerns regarding the hospital's ability to provide adequate and timely healthcare services to the public. And on this issue of human resource, Mr. Speaker, I think Her Excellency the Governor has raised this even before the honorable members, and maybe, and I don't want to talk for the Chairman Health, is that we need to maybe do an extra allocation in as far as the budget is concerned, because it is only the budgetary allocation that is going to unlock this issue of human resource. Mr. Speaker, the committee made the following recommendation over the same. 1, the hospital management should work in collaboration with the County Public Service Board to expedite the recruitment of the required personnel to bridge the existing staffing gap. Priority should be given to critical care specialists, such as anesthesiologists. Mr. Speaker, I don't know whether I'm pronouncing that word correctly, but of course I believe we have doctors within the House who can correct me in case I make wrong pronunciation. Pediatricians and radiologists. Mr. Speaker, another recommendation that was made by the committee is that the county government should allocate sufficient funds for the procurement of required medical equipment, including ICU beds, HDU beds, and dialysis machines to ensure compliance with the Kenya Quality Model for Health Policy Guidelines. Mr. Speaker, another recommendation, the hospital management should ensure strict adherence to the first schedule of the Health Act of 2017 and other relevant legal provisions to mitigate risks associated with non-compliance. And lastly, a structured monitoring and evaluation framework should be established to track progress on staffing, equipment procurement, and service delivery improvements. Mr. Speaker, second last, the reason that was put forward by the Office of the Auditor-General is unfulfilled orders of pharmaceuticals and non-pharmaceuticals. Mr. Speaker, in the review of the ordering records indicated the hospital made quantity orders of 100,372 units for various medical commodities from the KEMSA authority, out of which only 79,823 units, about 80% of the orders were received, resulting to fulfilled orders of 20,549, that in terms of percentage, that is 20%. In the circumstances, the effectiveness management of pharmaceuticals and non-pharmaceutical stocks could not be confirmed. Mr. Speaker, the committee on this one, which is a serious issue for that matter, because even the 20% that was not delivered, it means, because that was a request that was made by the management of the medical superintendent and the whole management of this facility. It means this 20% was required in this particular facility. Therefore, these 20% not being delivered to the facility, then it means there were some of the services that, of course, were affected. The committee had the following findings. 1, review of the ordering records indicated that the hospital placed orders for the said unit, that is 100,372 units of various medical commodities from the Kenya Medical Supplies Authority, that is KEMSA, out of which 79,823 were supplied, leaving unfulfilled order quantity of 20,549. In short, what the committee was saying is that, of course, they agreed with whatever, after interrogating we agreed as a committee with what the Office of the Auditor-General said. Number two, the inconsistency in order fulfillment compromises effective stock management and disrupts service delivery. Mr. Speaker, on this, the committee had the following recommendation: that the hospital should improve its procurement and supply chain management to ensure that all orders are fulfilled in full. Management should work closely with KEMSA and, of course, other suppliers to address supply chain challenges. It should implement better forecasting methods to prevent the stockouts. Mr. Speaker, we also have the issue of expiry, which is very serious again, Mr. Speaker, the expiry of medical supplies. Mr. Speaker, during the time of interrogation, then the committee was able to establish that in Molo Level 4, Sub-County Level 4 Hospital, there were 50,944 units of various drugs, of course, that were expired. Further, the stock cards, of course, the stock cards that is supposed to show the drug itself and the expiry date, of course, was missing. So, in the circumstances, the effectiveness of internal controls of the management of the pharmaceutical and non-pharmaceutical were not effective. Mr. Speaker, the committee had the following findings, two of them, over the same. One, the hospital failed to maintain effective internal controls over pharmaceuticals and non-pharmaceuticals, leading to expired stock accumulation. A total of 50,944 units of expired drugs were recorded with no clear variation of losses. But of course, I believe, Mr. Speaker, this loss must be huge for that matter. The absence of batch numbers and expiry dates on stock cards further weakens traceability and accountability in drug management. And Mr. Speaker, the committee made the following recommendation: that the hospital should develop and implement better inventory management practices, including ensuring that batch numbers and the expiry dates are recorded in the stock cards. The county government should expedite the procurement of an incinerator to dispose of expired supplies in accordance with the health and safety regulation. Mr. Speaker, you know, one thing that, of course, even surprised us as a committee is that maybe the disposal of this expired. First, we have to ask ourselves why we should have the expired drugs in the first place. But because it's there, then another thing that shocked this committee is that for us to expose as a county, to expose these expired drugs, it has to be done within a central position. Then it means, Mr. Speaker, according to me and the simple mathematics that we were doing as a committee, is that maybe transferring some of these drugs from Molo and all across the county. This only because they are saying it's expensive. That is why they are saying they cannot be able to do it within their specific facilities. If it is expensive, Mr. Speaker, transporting these particular drugs, expired drugs, to a central place, let me say, for example, Nakuru. If we are transferring these drugs, expired drugs from Molo, from Kiringet, from Maela, bringing it maybe to a central place, is it not going to increase this, what they are talking of maybe being expensive? It is even going to be more expensive. So we do not see the rationale, but of course, we are going to invite, of course, the Department of Health maybe to shed more light over the same. How transporting expired drugs from across the country to a central position is going to reduce the amount that is, of course, used to expose these expired drugs. Mr. Speaker, we have the last one, the stockout, experienced stockouts of medical supplies ranging from 4 days to 364 days. Then it means almost across the year, Mr. Speaker, at one point, we must have a drug that is not available. And of course, this is ironical, because on one side, we are talking of expired drugs, but on the other side, we are talking of maybe the stockouts. Of course, this one is not making sense, Mr. Speaker. And On the same, the committee had the following findings. One finding. The hospital experienced stockout and essential medical supplies ranging from a few days to over a year, indicating weaknesses in the procurement process and the financial constraints affecting the hospital's ability to maintain adequate inventory levels. And Mr. Speaker, the committee made the following recommendations. One, the hospital should work on securing sufficient funds for the procurement of essential medical supplies. Efforts should be made to ensure that essential suppliers are available at all times, and stockout instances should be minimized through better planning and forecasting. Number two, Mr. Speaker, is that adoption of an alternative procurement strategies. The hospital should diversify its procurement sources. That is, maybe they should not rely on KEMSA alone. Number three, Mr. Speaker, the county government should allocate additional funding for pharmaceuticals and non-pharmaceuticals procurement to minimize stockout risks and ensure uninterrupted medical supplies. Mr. Speaker, in conclusion, the committee, after a thorough review and discussion for the Auditor-General's findings, despite these challenges, the hospital management has acknowledged the audit findings and provided explanations and commitments to address the identified concerns. Key steps include initiating corrective actions such as valuation and documentation of assets, enhancing revenue collection and transfer mechanisms, and improving stock management practices. To ensure compliance with financial and governance regulations, it is recommended that the hospital implements robust internal controls, strengthens oversight mechanisms, and enhances financial and operational transparency. Additionally, collaborative efforts with the county government and relevant regulatory authorities will be essential in addressing systemic challenges, improving healthcare services delivery, and ensuring efficient utilization of public resources. Going forward, adherence to financial regulations, effective risk management, and improved governance will be critical in enhancing accountability, operational efficiency, and sustainable healthcare provisions at Molo Sub-County Level 4 Hospital. Thank you, Mr. Speaker, and I want to call upon Mheshimiwa Sakwa from Kivumbini to second the motion. Thank you, Mr. Speaker.
Honorable Sakwa.
Thank you, Mr. Speaker, sir. I do second this motion. Honorable Speaker, maybe I just request for 1 minute so that maybe I do my emphasis on one area of great concern. Honorable Speaker, this is not the first report from Health Department, maybe through the PAC Committee to this Honorable House, and the same is not the second report. Honorable Speaker, if we can go through these records for the committee findings and recommendations, we find that other reports that will be coming to this great house will be having the same findings and recommendations to a tune of 70%. So this may be, as my chair was going through the same area, maybe it is just maybe to request the committee on implementation committee and lands committee on the area of ownership. Because, Mr. Speaker, sir, that's a great concern, and maybe as the committee will implement these other reports that will be coming in this house, maybe we should have gotten a solution. Thank you, Mr. Speaker, sir.
Thank you. I will now propose the motion which is that this House adopts the report of the Committee on County Public Accounts and Investment on the Auditor-General's report on the examination of financial statements of Molo Sub-County Level 4 Hospital for the year ended 30th June 2023, laid on the table of the Assembly on Tuesday, 27th May 2025 during the afternoon sitting. The motion is open for debate. The Honourable Member for Lakeview.
Mr. Speaker, first and foremost, I'd like to appreciate the committee on PAC because of the good report that they've given us. An auxiliary report from the Office of the Auditor-General, Mr. Speaker. Mr. Speaker, it's worth noting that as much as we have the reports from the Auditor-General, we as the lawmakers of this assembly must appreciate that within Nakuru County, we have the highest budget within this region on health. Mr. Speaker, our budget goes at between 38 and 40% of our budget. In this financial year, Mr. Speaker, as the chair budget can indicate very well that we have had, Mr. Speaker, I'm being distracted here.
Do you know who is distracting you?
The Deputy Majority Leader, Mr. Speaker, sir, on a phone call. Mr. Speaker, if I may proceed, when in this financial year, Mr. Speaker, we had around 8.8 billion Kenyan shillings going to the health care, Mr. Speaker. If you look at the indigents that have been kept within Nakuru County, we have had the commitments from the national government, and the commitments have not been honored, Mr. Speaker. And I want to stand here and say that the counties, not just Nakuru County, all the counties within this country, Mr. Speaker, are straining because health is devolved, Mr. Speaker, but not fully devolved, Mr. Speaker. So much money is still being retained at the national level, Mr. Speaker. The Hon Chair, PAC, has raised a very fundamental issue here, Mr. Speaker, on casuals that are still, that have been forced to work for more than 3 months, Mr. Speaker. Yet, Mr. Speaker, the national budget, Mr. Speaker, if you look at the national budget on health itself, goes to around a tune of around 108 billion Kenyan shillings, Mr. Speaker. This is an amount that should be taken back to the counties, Mr. Speaker. Mr. Speaker, when I go back to the rollout of SHA and SHIF, Mr. Speaker, you find that NHIF went with so much money that belong to the counties, Mr. Speaker. How are counties able to survive the shockwaves of the money that they could not recover from that, Mr. Speaker? Mr. Speaker, it is time that the national government releases funds back to the counties at the county level, Mr. Speaker. Without that, Mr. Speaker, we shall have so many crazy reports from the Office of the Auditor-General, Mr. Speaker, but we are not helping what we have, Mr. Speaker. Mr. Speaker, if you are an active member that follows things online, Mr. Speaker, you will realize that health is not just an issue that is affecting Nakuru County. By tonight, Mr. Speaker, by yesterday night, Mr. Speaker, you will realize that Gen Zs around the country, they have started to build their own hospital, Mr. Speaker. Young people have started building, the TikTokers have initiated an initiative, Mr. Speaker, of doing their own hospital, Mr. Speaker. So this is not an issue that we can gamble with and think that we are doing well as a county, Mr. Speaker, or even as a country, Mr. Speaker. It calls each and every member to call out the national government where we fail, because health affects each and every person. Mr. Speaker, I'm touched when I go through our hospitals some of the times, and I look at the linen that our patients put on, Mr. Speaker. They are so low, and not just in Nakuru County. Go to Kenyatta National Hospital, Mr. Speaker. In my own ward, on Friday, I'll be burying a patient that I went to observe in Kenyatta Hospital on Sunday, Mr. Speaker. And when I got to Kenyatta National Hospital, Mr. Speaker, the issues that I found there, Mr. Speaker, the patient didn't even have proper linens, Mr. Speaker. So these are things that are affecting us, and we cannot continue keeping quiet as a country. We must talk about them. There is an issue that caught my ears, Mr. Speaker, on drugs that expire on counter. Mr. Speaker, as a medic, I will indicate here that there are times that when the national bodies that bring medicine to the country, when they order some medicine at the national level, Mr. Speaker, you have a body that is called KEMSA. When KEMSA orders drugs, it orders drugs according to the report that they receive on the ground, that this year the drugs on HIV must be on this level. Tuberculosis, which will accompany HIV, will be this quantity. And you'll find that some regions, Mr. Speaker, when the drugs that are on stock within KEMSA are almost due dates, Mr. Speaker, the hospital will be asked if you at all you can get this medication, help your patients free of charge. And I believe that is the case within Nakuru County. That at one point, Mr. Speaker, between 2021, 2022, 2023, Mr. Speaker, we were asked by KEMSA to come and pick some medicines within KEMSA so that they don't go bad or they don't go stale within the counters of KEMSA, Mr. Speaker. Mr. Speaker, it is good that we appreciate where things go wrong at national level, Mr. Speaker, because we can confine ourselves in a cocoon of the county level, yet we forget that we live in the global village called Kenya. And with that, Mr. Speaker, I wish to state that health issues should be taken seriously, and I would want to commend the Committee on Health through the Chair, Njuguna from Elbagon, who has led us to producing proper reports. And I believe last weekend, or last week, we held a very proper discussion with Her Excellency the Governor on the health issues of this county. And I believe that we got an insight, an in-depth insight of what is happening. We appreciate very well that we don't have enough workers within Nakuru County. Some of the hospitals, Mr. Speaker, are served with one nurse who, if at any point of an accident or emergency, is supposed to accompany that patient. For instance, if we had a mother in labor, Mr. Speaker, in a hospital, the ambulance that comes to pick that mother must travel with that nurse who is there, Mr. Speaker. What if there is another mother and another mother in the queue, Mr. Speaker, who still require attention of the hospital, Mr. Speaker? Mr. Speaker, I believe that we are of age as a country that we repair the healthcare system. And Nakuru should not be left behind at the national level. I'll caution this assembly and tell them that we have the largest cancer center within this region, Mr. Speaker. People from Bomet, Kericho, all the way to Laikipia, Nyandarua, all of them storm within these hospitals that we have here in PGH, Mr. Speaker. It is the biggest, Mr. Speaker. From ours here, we have another one in Mombasa, which is almost not functioning. We have another one in Kenyatta, Nairobi, Mr. Speaker. So let's appreciate what we have, and I believe that the Office of the Auditor-General will also audit the funds that we have at the national level so that they can trickle down to Mwananchi. That is the spirit of devolution that the promoters of the Constitution of Kenya 2010 so good to pass that constitution then, Mr. Speaker. Otherwise, Mr. Speaker, I'd like to support this report. It's a good report to this county. Thank you, Mr. Speaker. Sir.
The Honourable Member for Nakuru East.
Thank you so much, Mr. Speaker. I rise to support this report, and I want to acknowledge the good work that have been done by the Committee on PAC. However, Mr. Speaker, sir, getting from the chair budget, his argument is based on a report like it's a report from Health Committee. This is a report from PAC, and this is a post-mortem report, Mr. Speaker, sir. As much as you may want to acknowledge the gaps that are there and the monies that have been delayed by the national government, we need to take people accountable for what has been done, Mr. Speaker. It is sickening to hear that, Mr. Speaker, there are no internal mechanism in Molo Hospital whereby it managed to even expiring of drugs. And from the committee's recommendation, they have recommended for the hospital to have an internal mechanism to have stock taking, Mr. Speaker, sir. Another finding from the committee, Mr. Speaker, is that even the facility itself, they are not remitting the money to the county exchequer. So, getting the facts and figures from chairman budgets, we need to have value for money. We cannot pump 8-point-something billion, and whatever little is gotten from those facilities, it's not taken back to the exchequer for the county, Mr. Speaker. So I want to invite members, when giving recommendations, let's give dire recommendation. I expect recommendation from the committee. Let's stop pumping money to this facility until they tell us what has been done with the money that has been given. So, Mr. Speaker, sir, I want to invite members to arise to the fact that this is money that we've pumped to facility, and we need to have value for money. And people have to account for whatever they have been given as resources from the county. I beg to submit, Mr. Speaker. Thank you.
Thank you. The Honourable Member for Dodori.
Thank you, Mr. Speaker. I ask to support the motion and report on Committee of Public Accounts and Investment Committee. Mr. Speaker, I want to just light on the basis of why this report came here on, and it is based on qualified reports, why it has lied to be a qualified report. Mr. Speaker, this is a reciprocal of what we have been seeing in other hospitals. Mr. Speaker, this report on Molo Hospital, it is very glibed on the issue that even the issue of land grabbing is given loom. Because the moment they have, you see their inventory, they even don't know how much land they occupy, the size of their land. That, Mr. Speaker, is an issue that needs to be relooked in, not only in Molo Sub-County Hospital, but in every hospital, so that we can have the inventory of these facilities, the number of vehicles they have, the number of buildings they have, so that we don't open looms for land grabbing. Mr. Speaker, on the issue of engagement of cashiers, non-payment of these cashiers is another issue, which, Mr. Speaker, I can attest to you that even today, in other hospital, in our hospital like in Bahati, we have that issue that is only ongoing up to now. And it is in a few years, only a few days, the same report will be brought in this assembly. I want to support my DS on that issue because we have to have measures or staff measures so that we can try to stop these reports coming in, qualified reports. Mr. Speaker, on the issue of hospital having drugs that have expired, it's not only in this hospital that we have drugs that have expired. And I will try to invest even the budget chair. Now that he has I've said the Committee of Health have enough money and enough budget to buy even drugs that can expire, and nobody is responsible for that. We visited Subukia, level 4 hospital. The same issue was seen. We had a lot of cartons of drugs that had expired. But our question is, yet drugs are expiring at level 4 hospital in Molo. Yeah, and we have level 5 hospital here in PGH. We need to have a strategy so that this medicine or pharmaceuticals, they can be transferred to where they are needed, so that it can be on a need-based procurement process. Thank you, Mr. Speaker.
What is the information?
Mr. Speaker, when you talk about medicine, there are drugs that are contained by the law of Kenya and the Kenya Medical Practitioner Board. There are medicines that cannot come from level 4 to level 3. There are medicines that cannot come from level 3 to level 2, Mr. Speaker. Even if Nakuru County wanted to transfer drug that is at level 6, it can't, Mr. Speaker. Mr. Speaker, for instance, when you're doing major surgery, there are drugs that you use, and that drug, that's where you have referrals, that you can get a patient being transferred from Naivasha all the way to Kenyatta Hospital, Mr. Speaker, because that drug cannot get out of the shelf without authorization from the doctor on that level, Mr. Speaker. So, Mr. Speaker, as much as we say that drugs should be descended downwards, Mr. Speaker, let's also live to that thought of the control of drugs within the country. Thank you, Mr. Speaker.
Thank you for that information. The Honourable Member for Malewa.
Thank you, Honourable Speaker. I wish to support this motion and commend the good job by the PAC committee. But allow me, Honourable Speaker, first of all, to send my condolences message to one of our staff, Mr. Rono, who has been a receptionist and still a sergeant at this house, who has lost his wife. May we as the house keep our senior in prayers, moral support, and also financially. Honorable Speaker, we can support that senior. As I support this motion, Honorable Speaker, Auditor-General gave a very comprehensive report, and Honorable Speaker, we ran through mistakes, Honorable Speaker. As we go through the report from which has been audited in this facility, it shows that according to her, or according to the report, there was a big failure from the Department of Health, Honorable Speaker. And it's good to note that as the auditors do their auditing, can we ensure that we give all the relevant documents are attached to are attached or are available, so that when he comes, it sounds, and okay, when the auditors come and find there is no document that is attached in the file or fails, it sounds that there is a failure somewhere, Honorable Speaker. And the only report he will give is that we have not complied with what we are supposed to do, Honorable Speaker. So I recommend the good job, and this auditing, Honorable Speaker, ensures that there is transparency, there is accountability, and all what has been budgeted or allocated, Honorable Speaker, goes line in line with what has been done, Honorable Speaker. I therefore raise to support this motion. Thank you.
Thank you. The Honourable Member for Mayela.
Okay, thank you, Mr. Speaker, sir, for this opportunity. And as one of us has said, we also relay our condolences to one of our support staff who's lost a wife. I also want to raise on this particular report by the PAC committee. And I just want to ride on the fact that the report is based on Auditor-General. And so as much as we want to blame anybody, I think we also need to look at ourselves from that mirror of accountability and transparency. And most of the times the reports we've been receiving here, Mr. Speaker, have an indication of a problem within the institutions we usually discuss. When somebody cannot be able to explain a simple fact of bookkeeping, then we believe that either in our staffs, in our health centers, we lack maybe a clerk or somebody who has enough knowledge. Because maybe we have nurses and we have doctors and maybe they don't have this knowledge. Is it a time that we decide whether it is possible to engage people who have got basic knowledge on accounting so that our records can be put straight? Yeah, Mr. Speaker, sir, in a committee that has continued to visit hospitals, and we've been going there on issues of revenue. But Mr. Speaker, the picture that is there is dangerous. We have institutions that run away completely from accountability. You ask them a simple question, they always have a reference to somebody else. Our institutions, Mr. Speaker, especially where we have finances and funds, have completely failed this county and even other counties. So that you find that what you give them, or whatever budget allocation you pump to these institutions or hospitals, will never be reflected in their books of accounts. When you ask a question like a simple question, at the hospitals we have PGH, annex, and all that. When it comes to finance collection, and even giving accountability of what they have has always been a problem. Mr. Speaker, sir, I was of the opinion that the PAC committee has done its work. This report is very, very comprehensive and very inclusive. Can we have a follow-up from the relevant committee on implementation and any other department that can be able to even respond to this report, particularly on Molo, and tell us what action can be taken so that the records we are having right now, we shall not have the PAC committee go back to Molo and bring another report to put on the shelves to start accumulating dust. Can this report be acted upon for once in this assembly so that we can see heads rolling? And this way you'll be able to have saved a lot of money. The PAC committee was even referring to instances when they don't have enough resources to do this work. So if we have to give resources for such kind of committees, then we also need to see action on the report that they produce so that this person who could not be able to, who could tell us that there's 7 million balances, and then another person reports a nil balance, and all this report is being based on Auditor-General report, then should be able to tell us what exactly is happening in this organization. We can't have an institution where people are just taking money like it is personal money, where they are taking issues like they are personal. I have no problem with expiring of drugs, because last time we sat with the governor, there was an explanation from the health CEC who started telling us about drugs that can expire because of logistics. Like, for example, AIDS and HIV drugs, and the way they are distributed to these hospitals. The PAC did not tell us exactly which drugs. Are they the very, very, very basic essential drugs, or they are these drugs that are usually distributing according maybe to chronic diseases that we have around? So what I can say is that the report was good, and I appreciate the work of the PAC, but I think we have failed as an assembly to follow up and give recommendation, because somebody has also mentioned that there is another report you are waiting for, and they are claiming that it is a replica of this report. So do we need now to get all these reports, or do we need to have action on the reports that are being received by this assembly? Mr. Speaker, sir, you have a duty to ensure that you even give timelines so that these issues that have been raised are looked into and they are reported back to this assembly so that you can be seen to be doing something. Otherwise, as far as I'm concerned, that is just another report, and we're also waiting for another one, and the cycle repeats itself. So, Mr. Speaker, sir, the ball is on your side. Just give us a reprieve so that we can see what that committee did as something that is needed by this assembly, and not only the assembly, even the communities that we serve. I support, and thank you, Mr. Speaker, sir.
The Honourable Member for London.
Thank you, Mr. Speaker, sir, for this opportunity. I also take this opportunity to acknowledge the good work that has been done by committee. Mr. Speaker, sir, we have been able to pass so many reports from this House, and the challenge that we have is from the other side, the executive, whereby I don't know whether they don't read this report or the reason as to why they don't implement, and they shelve these reports, which come with the recommendation, if followed, we can be able to transform this county and this country, Mr. Speaker, sir. Mr. Speaker, sir, on the issue on expiring drugs, Mr. Speaker, sir, I believe if this facility can be able to apply different model, like FIFO, not LIFO, Mr. Speaker, sir, where FIFO is first in, first out, rather than last in, first out, Mr. Speaker, sir. If they can be able to adapt those kind of ways, Mr. Speaker, sir, I believe we can be able to rest this issue once and for all. The other thing, Mr. Speaker, sir, in regard to remuneration and or payments, Mr. Speaker, sir, we have a problem whereby staffs are paid they are paid not in time, Mr. Speaker, sir. This can create a loophole whereby these facilities or these drugs that are within hospital facilities, they get away to get into either chemist or private entities, Mr. Speaker, sir. If there is a way that we can be able to ensure that staffs get payment at real time, Mr. Speaker, sir, we can be able to do away with these drugs getting to other facilities, Mr. Speaker, sir. The other thing, Mr. Speaker, sir, the way that we recruit those officers who are doing in our facilities, Mr. Speaker, sir, have to be relooked, Mr. Speaker, because sometimes we don't get the qualified staffing in this facility, hence not being able to exploit whatever that they were able to learn or whatever that they are supposed to do in these facilities, Mr. Speaker, sir. So we have to relook on ways on how to be able to motivate these staffs, and also, Mr. Speaker, sir, to be able to ensure that we take them regular training so that they can be able to catch up with the technologies that is working, and also to be able to catch up with how the world is moving, Mr. Speaker, sir. Mr. Speaker, sir, those are my few remarks, and I support this report. Thank you, Mr. Speaker, sir.
Thank you. The Honourable Member, the Honourable Leader of Majority Party, and then the Honourable Wamaitha. Then the mover will reply.
Thank you very much, Mr. Speaker. I stand to support the report, and my concerns are really drawn to 3.4, failure to transfer revenue to the county revenue fund accounts, where I've noted that about 70 million Kenya shillings were not transferred to the county revenue fund accounts. And I'm one of the people who sit in the finance committee, and we are so much concerned with the collection of revenue in the county. And looking into this statement, Mr. Speaker, some of my concerns is that it's a bit worrying if revenue management is not properly taken into consideration. I'm more even attracted by the recommendations that are made by the committee, that the hospital should actually adhere to some of the regulations. And I just feel that adhering to the regulations only is not enough. I think some severe action should further be taken. One of the members, Honorable Jen, has just said that possibly there is a lapse. We don't have qualified accountants. And since we don't have qualified accountants in our hospitals, that could even be delaying remittance of the collections or the revenue that is collected in the hospitals. And for that reason, therefore, one further recommendation that I would also propose is that we get people who are experts in issues to do with accounts, so that they be assisting in the remittance of these monies to the relevant accounts. And more so, if there is somebody also who is lying on his or her job, then a further action should also be taken into consideration. Because if this is an indication from one facility, 70 million Kenya shillings, what about the other facilities that we have across the county? So I want to feel that much should actually be done. Thank you, Mr. Speaker.
Thank you, the Leader of Majority Party. The Honourable Wamaitha.
Thank you, Mr. Speaker, for giving me this opportunity to give my thoughts and my remarks on the motion before us, on the report given to us by the PAC. I do not want to reiterate the gaps that have been flagged by the Auditor-General and the PAC committee. But however, Mr. Speaker, This is why the she and SHA are critical in this situation, Mr. Speaker. She and SHA is a manifesto that our party initially we introduced in the country as a reform to change the medical facilities in our country. Mr. Speaker, SHIV will ensure strict accountability so that we have payments in the hospitals directly, so that we can have payments directly paid in the hospitals. Mr. Speaker, if you can recall, when we are registering the SHI, during one of the key critical elements that you have been asked is, which is your nearest hospital? Mr. Speaker, this is not just merely introducing something, but being asked which is your nearest hospital is to ensure that the drugs that you're given by the doctor are available in that hospital. Therefore, Mr. Speaker, I urge all hospitals countrywide to embrace SHI and SHA, because these two, SHA will bring resources and SHIV will bring accountability. Mr. Speaker, under the SHIV, we ensure that there's digital stock, we can have digital stock prediction, such that a hospital can track their stock anywhere in the country. This will ensure that we have proper procurement systems in the hospitals, Mr. Speaker. Clearly, the entire audit report is all about accountability and stock, because, Mr. Speaker, sir, health is such a critical ingredient in our country. And if we do not embrace the new reforms that our government is putting in place, that we will always have the audit queries and the audit reports and the gaps that have been plugged by the Auditor-General. Therefore, Mr. Speaker, SHI and SHA is the solution to the audit queries that have been put before this House. Thank you, Mr. Speaker.
The Honorable Chair.
Thank you. Thank you, Mr. Speaker. And I want to appreciate all the sentiments that have been brought forward by the honorable members. And I believe all these sentiments are brought forward, of course, to increase efficiency in the said entity, that is Molo Level 4 Hospital. Mr. Speaker, I want to agree with Mheshimiwa Alex that some of this national money that is supposed to be devolved to the counties to be devolved, because of course it means if we have devolved a function, then this devolved function must be accompanied by the resources. And it is very unfair if the national government have devolved some of these functions to the counties, but of course the money remains with the national government. That is not fair to the counties, and I want to agree with Daktari that this money, you devolve the service, you devolve the resources as well. But I want to disagree with Daktari Alex, Mheshimiwa Alex, who is also doubles up as Daktari, that of course we have the OAG deals with the money that has been allocated within the county, not from the national government. And therefore, the report that we normally interrogate, Mr. Speaker, is for that money that has already been allocated to that particular entity. Mr. Speaker, Honorable Deputy Speaker, that is Anthony Kanyiri, I want to agree with him that of course the money that has been allocated, the people concerned or the management has to explain to us first what they have done with the allocated money. However, Mr. Speaker, I want to disagree a bit with him by saying that we should not allocate money. We should hold those people who are supposed, of course, to make prudent management of the resources. But of course, if we deny these facilities money, then automatically services are going to be affected, and this one has direct negative impact on the common mwananchi who needs these services. Mr. Speaker, I want to agree with Honorable Gadoita from Dundori that, of course, we will encourage, and we are encouraging land grabbing by, of course, not establishing the ownership of those particular pieces of land on which some of this facility lies. If there are no documentation to show the ownership, and some of these people have become very smarter, even people surrounding that particular facility, they will know that there is no documentation. Remember, some of these board members, they are formed by some of the members from the surrounding of these particular facilities. And they will even, maybe this information is going to go out, that this particular facility does not have the legal ownership document for that particular facility. And of course, this one is going to encourage those land grabbers to continue grabbing the land that, of course, supposed to be owned by that particular facility. If, for example, even the vehicles themselves, if they do not have the ownership document, then, Mr. Speaker, I don't see the reason as to why these cars cannot be sold to the outside buyers, outside the facility buyers, simply because there are no documentation. Therefore, I want to agree, this issue of ownership, having ownership documents is very critical in these particular facilities. If the computers do not have the ownership document, then we are also even going to encourage, even from within the facilities. We have some of these very few rogue members or rogue officers from that particular facility. Theft of such things can be encouraged. And of course, to curb all this, then, Mr. Speaker, we need to have ownership documents for all that is contained within that particular facility. Mr. Speaker, I want to agree with Mheshimiwa K5 from Malewa that it is a problem that during the whole of this audit process, you are asked to provide the documents, but of course you are not doing so. Then it means there is something that is malicious that of course you want to do, or even tampering with the existing documents. So therefore, the documents must be availed when requested by the Office of the Auditor-General. Mheshimiwa Jane Maera, I want to agree with him because I'm also a member of the Finance Committee, and I want to, of course, agree with her, Mheshimiwa, that of course there are some facilities that don't want to be accountable, particularly when issues of collecting money is concerned. And also I want to agree with Mheshimiwa Maera, Mr. Speaker, and I think this is what I said in my initial statement, that of course some of these reports, if we continue, I as the chairperson, we sit down with our committee, then we do our findings, we do our recommendations. Then we bring them here before this honorable house. And there is nothing that is going to be done by, of course, the concerned committee. Then this is like a song. And even people outside there, Mr. Speaker, maybe are not going to take this house seriously because they know. Because this is something that is live. And everybody outside knows that, of course, we are bringing forward a report on the Auditor-General specifically for Molo. We have done so before. I have not seen quite much being done, and I am, with all the respect to Mheshimiwa John Mwangi from Turi, not much that has been done by the implementation committee. Of course, people will know that we normally do reports, but no recommendations that of course are implemented. So I want to agree with Mheshimiwa Jane that the relevant committee, that is specifically the implementation committee, should make sure that the recommendations that have been put forward by the Public Accounts Committee, of course, have been adhered to. So, Mheshimiwa Jane, maybe the work of the Public Accounts Committee, and I believe we have done our work diligently. Of course, the reason as to why we are requesting for more resources, Mr. Speaker, is that, of course, we have to set aside extra days to do interrogation, because, of course, we require a lot of time, of course, to do interrogation, and then we give, of which we have done. We have interrogated some entities, we have given our recommendations. Now, it is upon the work of the other committee to take up whatever has been put forward by the Public Accounts and Investment Committee. The drugs, of course, the drugs, I want to say, Mheshimiwa Jane asked whether they were essential or not. I am sure, I'm not within that particular Department of Health, but I'm sure, in as long as those medicines were requested by the management of the hospital, then I believe those drugs must be very essential, and therefore, it is not a question of whether they are essential or not. They must be provided as long as they were requested. So, Honorable Gattuso, of course, again, the question is, you have talked about the implementation committee. My question is, has this implementation committee invited these relevant authorities that you are talking about, including the executive? Because that is where the question, because the people who are going to answer some of these findings and recommendations are the people from the executive, yes. But the question is, has the implementation committee invited them to come and answer some of these issues? I don't want to dwell so much on the issue of payment of the cashiers, because I believe in the House we have a committee that is supposed to be dealing with such issues, and I don't want to go into that particular direction. And I believe Mheshimiwa Wamwadhi, who is supposed to maybe take up this matter, of course, is getting this. Majority Leader, you know, the issue of maybe submitting the money, you know, when they were giving their response, because they were trying to quote that there is this Nakuru subsidiary legislation of 2016, section 3.3, which states that the earning, accruals, and the balances of the services at the close of each financial year shall not be paid in the consolidated fund, but retained in the facility. But of course, the national law, that is the PFM Act, of course, is going to supersede this subsidiary legislation. That is why we recommended as a committee, they have to follow the national law. And of course, it supersedes this one. Then, I want to agree with Honorable Ann Daktari, and it is good to include that Daktari, because personally I don't earn that title. And if Mheshimiwa Ann has earned that one, it is good to consider that. Honorable Dr. Ann, we want to encourage maybe our members to register for she and SHA. And therefore, Mr. Speaker, thank you.
Thank you, Honorable Chair. I will now put to question a motion that is that the House adopts the report of the Committee on County Public Accounts and Investment on the Auditor-General's report on the examination of the financial statements of Molo Sub-County Level 4 Hospital for the year ended 30th June 2023, laid on the table of the Assembly on Tuesday, 27th May 2025 during the afternoon sitting. As many who are of that opinion say aye. Aye. As many who are of contrary opinion say nay. The ayes have it. Next order.
Mr. Speaker, sir, those are the orders of the morning sitting.
Honorable members, this House is adjourned to today, 2:30 p.m. Thank you.